This press conference is a vital tool for all of us to get through the crisis. This continues to be the most trusted place for the people of Rhode Island to receive their information. And as the crisis drags on, as the stories coming out of places like New York City, New York, Seattle, California are getting to be pretty urgent, I need Rhode Islanders to stay focused on what we have here, the plans that we have, and the directions that we are giving to the people of Rhode Island so that we can get through this as quickly and safely as possible. So again, thank you to everybody for tuning in. Today we have 18 new cases in Rhode Island, 18 new cases of coronavirus for a total of 124 cases. And in a few minutes, I'll ask Dr. Nicole Alexander-Scott to go through the details of those cases. I have a few additional announcements as we continue to meet the needs of the crisis. First, I want to quickly mention one announcement that I wasn't able to get to yesterday, which relates to the date of the presidential primary. I am heeding the advice and the guidance of the Board of Elections to move the presidential primary date from April to June 2nd. So we will have our presidential primary election in Rhode Island on June 2nd. I'm going to be signing an executive order to that effect, and it will be a primarily mail ballot election. So this is an opportunity for us to be innovative. It's an opportunity for us to try a mail ballot election, and I'll be working very closely with the Secretary of State and the Board of Elections, and I am confident the Secretary of State will be able to successfully execute the primary in a mail ballot fashion. The thing that I'm hearing an awful lot about, questions about, relates to childcare. So I would like to take the next minute or two to outline some of the measures that we've put in place to deal with the childcare and elder care needs of Rhode Islanders. The reality is a lot of people are still working because they have to work. First responders, those of us fighting the crisis on the front lines in the public sector, doctors, nurses, healthcare workers, elder care workers, and many of these folks are parents. We also have many, many thousands of people working from home, and in order to be productive working from home, you often need a babysitter or someone to watch your elderly loved one. To that end, I'd like to make the following announcements. As I have said so many times, and I will continue to say, I want to do everything we can to maintain some semblance of an economy until the point in time, which I hope is soon, that we can start turning the economy back on. Child care and elder care provisions is one such provision that we have to make so that folks can continue to work and their kids and loved ones are safe. So I'm proud to announce right now that Rhode Island is the first state in the country to partner with a company called Care.com to help our workers access child care and elder care. So I've been in touch with Care.com, with their chief executives and their team, and I want to thank them so much for their cooperation. They have agreed to provide to the people of Rhode Island 90 days of free premium service at Care.com. Care.com has created a new website specifically for the people of Rhode Island, such that starting today, anyone in Rhode Island looking for child care or elder care can visit care.com/RINeed, and you can look for a babysitter, child care provider, an elder care provider. As I said before, our medical professionals, emergency workers, folks working in the grocery store, people working in a pharmacy, members of law enforcement, there's so many people not only working, but are working around the clock, and many folks working from home. So I hear you. My husband and I are working parents ourselves. I hear you loudly and clearly, and this is one thing that I'm pleased to be able to offer the people of Rhode Island. Care.com, special Rhode Island site, open today, free service for 90 days to help you go ahead and find childcare and elder care. On the flip side of that, I know there are a lot of Rhode Islanders out of work. So if you're out of work right now, this could be a way to earn a little money. You know, I've heard from some physical therapists who are out of work. Perhaps you can get matched up with somebody who's in need of elder care. I know there's waitresses and other child care workers who are out of work. Perhaps you could offer your services on care.com. I realize this is very imperfect, but it's a way to make a little bit of money in the next couple of weeks as we get through this. We're also hearing from so many Rhode Islanders, God bless you all, who want to volunteer. People who typically volunteer in hospitals, they can't go into the hospital. They are reaching out to us in droves saying, hey, I want to help. I can volunteer. So care.com has a special way for volunteers who want to offer your child care services or elder care services for free. So you can go on care.com, offer yourself as a volunteer, and for those folks who can't afford to pay for a babysitter, you could specifically search for a volunteer to be a babysitter on the care.com website. I'm also proud to announce that there are several child care facilities with whom we are working to enable them to stay open. Specifically, the Boys and the Girls Club, the Greater Providence YMCA, Children's Workshop, Children's Friend, and Learning Brook. All of these will offer on-site child care for children of essential hospital workers. Boys and Girls Club, Greater Providence Y, Children's Workshop, Children's Friend, and Learning Brook. So these are center-based child care facilities, and the Department of Human Services will be matching those facilities up with hospitals to make sure that the healthcare workers in those hospitals have some place to put some safe place to bring their children in the morning or in the evening while they're at work. DHS will be notifying each hospital who's eligible and which child care provider we're matching you up with. We have been receiving many questions from child care facilities about whether they're allowed to reopen or stay open at this time. So a week or so ago, I advised child care centers to close. That was our recommendation. We are hearing from some child care centers that they would like to remain open. And by the way, I'm grateful to you for being willing to do that because, as I said, people need child care in order to work. So the following is what our current arrangement will be, and I want to reiterate, or I want to mention, this is a current arrangement which we will continue to evolve and add on to as we continue to, excuse me, reopen our economy. Child care centers can choose to continue to operate. However, any child care center that chooses to remain open during the crisis may only do so under new emergency regulations that are being promulgated by DHS. So at this point, I want to thank Courtney Hawkins, who runs DHS, who's with me today to answer any questions. She has worked to promulgate new emergency guidelines. Those guidelines have been created in partnership with and consultation with the Department of Health and other public health experts and the CDC, which are strict guidelines for child care centers to follow if they want to stay open and safely serve kids in their centers in the coming weeks to help us get through this crisis. I want to be very clear. I am grateful to child care centers who want to work with us, who want to be collaborative, who want to stay open. I also want to be very clear that you must follow the new emergency regulations so we can keep you, your employees, and the kids you serve safe. As a result, DHS will be strictly enforcing the new guidelines, including by making surprise visits to child care centers just to make sure the rules are being followed. I want to emphasize again, I know this is hard. I know every solution that I am putting out there is imperfect. We are trying every day to do the best we can to meet the needs of this crisis, and our response is incremental and will continue to improve. So, to the list of child care providers that I listed who are helping our hospital employees, thank you, thank you, thank you. You've been incredible. And just thank you so much on behalf of Rhode Island and the hospital employees who you'll be serving. To any of the folks who go to sign up to be babysitters or elder care sitters or volunteers, thank you. OnCare.com, I'd like to say thank you to you. And to the child care centers who are willing to consider staying open, please consult with DHS and we'll give you the guidelines so you can do that safely. I want to make a note about distance learning. I had a round of phone calls last night with a number of superintendents throughout the state, and all reports are very positive. Hats off to you. Hats off to you, superintendents, principals, teachers, parents, students, for leaning into this and for your willingness to innovate. The early reports, recognizing it was one day, are very positive. Students are showing up. They're taking attendance. We're having excellent attendance records by students. Obviously, there are many kinks in the system to be worked out. We're not pretending that there aren't, but we'll be, as I said, we'll be better today than yesterday. We'll be better a week from now than we are today. To all of you who are leaning in and putting your back into this, I want to say thank you. And early reports, by all accounts, you're off to a terrific beginning. Unemployment insurance. So I take a daily track of Rhode Island's unemployment insurance claims. And it should not be surprising to anyone that they are shooting through the roof. We are surpassing anything we've ever seen before. Much, greater than in the last Great Recession. The peak before that was the banking crisis, much, much greater than what we saw then. It is my sincere hope, and I am working every day to reopen this economy as quickly as we can, and it is my hope that these are temporary as possible, as limited in time as possible that you're unemployed. Having said that, this is a really tough time, so I have waived the waiting periods, typical 7-day waiting period for unemployment insurance and TDI. We have waived that. We are encouraging you to file for unemployment insurance if you have been laid off. We are going to pay every claim, and you can rest assured that the money is there. You'll get your UI check, and it is a place that anyone who's unemployed can go to find some compensation. That said, as you can imagine, we are truly overrun by thousands and thousands of claims every day. Please don't call us to check in on your application. Every time somebody at the Department of Labor and Training has to answer the request of, where is my application in the queue, that's time that they could be spending processing your claim. So we're really overrun right now by calls, just people calling to check in, how are you doing on my application? We're doing everything we can to get your payment to you within 10 to 12 days. Hopefully sooner, but we're trying to get everyone paid within 10 to 12 days. If you have some kind of an emergency situation, you can email in, or in that rare instance, you can call in. Please do not show up at the Department of Labor and Training. There are no drop boxes outside, and we are encouraging everybody to stay home. There are 2 ways that you can file for unemployment insurance, by phone or online. If you have an ability to get to a computer and go online, we'd like you to go online and file for unemployment insurance online. If you don't have a computer or can't do that, then you can call to file your claim. Please do not show up, and please try to resist the urge to call and check in on the process, because that's just going to slow us down and make it harder for us to hurry up and get the money to you. Rest assured, it is at the top of my list. We're making improvement every single day to get the money into your hands as fast as possible. By the way, I want to thank the extraordinary folks at the Department of Labor and Training. They are moving quickly, working around the clock, expediting this, and so Scott Jensen and your team, thank you for your hard work. Two more things I'd like to highlight. One relates to maintaining state operations, and it was a question that I received yesterday. Like every state, like every business, our revenues are way down. The federal government pushed back the tax filing deadline from April to July, and I followed suit. So that, of course, puts a serious revenue pressure on the state. As a result, I have asked the leadership of the General Assembly to convene the Disaster Emergency Funding Board to take immediate and emergency action to enable the administration to go into the private market and secure a line of credit. This is extraordinary, obviously, because we are living under an emergency situation. It's also exactly what we should be doing, and it's what every business is doing. It's prudent to line up liquidity so we can continue to operate, continue to pay the bills until we get back on our feet. I want to I have been in touch over the past couple of days with the Speaker and Senate President. They've been fantastic. They're convening a meeting this week, and the Treasurer has been excellent, and I hope to be able to go into the market very soon to secure a line of credit. This should not alarm anyone. This is actually good news. It means we're taking action, not sitting around and waiting, taking action so Rhode Islanders are safe and secure, and we could continue to run the government to the best of our ability in these extraordinary times. Finally, I want to make a note about mental health, as I have done in many of these press conferences. Tensions are rising. There is no way around that. It is hard to live without a paycheck. It's hard to live without your kids going to school. It's very hard to live in this period of uncertainty. And it's a challenge as the days go on without any specific date by which we know we'll be out of this mess. It's totally normal to feel anxious about that. And it's normal for adults, but also we're hearing from a lot of kids. Many, many children are saying, what's going on? What does this virus mean for me? When's it going to end? How do I deal with this? Very common, what we're seeing and hearing. So let me say this. The best thing I think that we adults can do is talk to our kids, answer their questions, and listen to them. And I'm actually planning to do a particular either telephone town hall or some way for me to interact with children in the coming week or so. But in the meantime, teachers, parents, adults in the lives of young people, if your kids have questions, try to answer them, direct them to our website, maybe this press conference. Just help the kids get facts. Don't allow yourselves to get isolated. BH Link is up and running. We have kids hotlines up and running. We have resources at the Department of Health and Buddha. We want to be there for you. So you have to be cooped up in your house, but you don't have to be alone. So don't let yourself become overwhelmed with the fear by being isolated. Reach out, get a hand, get the information that you need. For everyone in Rhode Island, I will say this. This is unprecedented. Every decision I make is a tough call. We're doing our best to balance public health and the economy. I fully recognize there's a relationship between economic health, and physical health. So I would just say, let's just hang in there with us a little bit longer. I want to move us to a place where I can begin to start opening up this economy in an incremental fashion. Don't ask me by what date, because I don't know, as soon as possible. And in the meantime, I'm putting in place the systems that will enable us to do that. So that's all by way of saying, we're not going to be living like this forever. This is a temporary moment in time, and we're going to take the appropriate steps in order to get us to the recovery phase as fast as possible. And we know from the experiences of other countries that that recovery is possible. So that I'm trying to provide you with some assurance that we have our eye on that prize. It's within our reach, and as other countries have done, we here in Rhode Island are going to too. And the whole thing depends on you, each and every one of you. Stay informed, facts not frenzy, and follow these directions. Many governors today around the country have put in place, shelter at home. I am not going there. I do not want to go there. My ability to hold the line on that depends on the people of Rhode Island's willingness to obey the rules that are in place. So far, you're doing a great job. So hang in there a little longer so we can get to the other side of this.